I'm very happy to welcome to the stage Claire Planner from the University of Manchester for our last talk of this session.
Hello everyone, so my name's Claire Planner and I'm a researcher at the Centre for Primary Care and Health Services Research at the University of Manchester, in lovely Manchester, which we have a picture of there. And I'm really, really excited to be here today to talk about our project on general practice support for autistic adults and discuss some of our emerging findings. This is an ongoing review. Okay, and I'd like to thank our excellent team, which are listed here, and this project is led by the amazing Dr. Kelly Birtwell, who's in the audience. I don't know if you want to give a wave, I'm embarrassing you there. And also give thanks to the stakeholders that are involved in this work through our Autism Insights group, our Professional Insights group, Salford Autism, and also Autism at Manchester. So if you are interested in the research that Manchester University is doing, if you click the QR code, that will take you to the Autism at Manchester website. Okay, so a bit of background. In the UK, autistic people have more unmet healthcare needs, face more barriers to accessing general practice, and report lower satisfaction with healthcare when compared to non-autistic people. So general practice has a really, really important role to play as the majority of healthcare is received in general practice. It's the first point of contact and it's the gateway service to the wider healthcare system, including specialist autism services. So our research questions were to review existing evidence to understand how does general practice support or not the differing needs of autistic adults across the lifespan. What contexts and mechanisms affect the ability of general practice to optimally support autistic adults, and what resources are available to support general practice care for autistic adults. And we've approached these research questions using a realist review methodology. So a realist review is a type of literature review which assesses existing evidence. It's theory-driven, so it's interested in how interventions or services work. It involves stakeholders throughout, working through 6 stages iteratively, as is shown in the diagram at the bottom of this slide. Okay, so in terms of selecting evidence to include in the review, we were interested in any type of evidence that was about either people with autism and with learning disability or without learning disability. The great thing about realist reviews is you can include a wide range of documents, so not just research. We've drawn on policy documents, think tank reports, discussion pieces. You can include a wide range of study designs, so not just trials. We've included surveys, qualitative research as well. So we searched 7 research databases from the inception of those databases up until 2024, and we will be updating those searches as well. Those searches identified 12,749 potentially relevant records, and from this we looked in detail at 899. And then at the moment we have included 24 records, and so these are our papers that are eligible for inclusion in the review. They meet our eligibility criteria. And if you're interested in learning more about the nitty-gritty of the methods for this, we have a paper, the protocol paper in press with BMC systematic reviews, and that should be published any day now. So do have a look at that if you're interested to see what we did in more detail. Okay, so in terms of stakeholder involvement, this has been critical to this project, and we've taken a kind of 3-pronged approach. So we have a autistic public co-applicant, Emily Corsellis, who is a part of the core team and has been involved in all aspects of shaping this research. We have 2 advisory groups, as I mentioned earlier. Our Autism Insights group is comprised of 5 autistic adults and 1 parent of an autistic adult. And our Professional Insights group is comprised of 6 professionals working in general practice and other healthcare roles as well. And they've been helping us interpret the data and identify resources. And then we have 4 autistic assistant reviewers who, in collaboration with Emily, have been screening research with us, extracting data from research, and helping us interpret that data, as well as helping us with dissemination. So 2 of our assistant reviewers helped to design this poster. Okay, so in terms of the results, we have we are grouping our results along the patient pathway that's outlined here. And I'm going to just share a few extracts relating to obtaining an appointment, getting to an appointment, and general practice interaction once you're in the surgery and having a consultation. Okay, so when doing realist reviews, what you're interested in developing are what's called context mechanism outcome statements, or CMO statements, and these help to explain the data that you have collected. So in terms of obtaining the appointment, one of our CMO statements is that if practices offer different formats for booking appointments, then cognitive demands are reduced, anxiety is reduced, and patients don't delay attending appointments. And I'm going to read out a quote that came from one of the papers that supports this CMO statement. So this is a paper by Taylor in 2023, which is about offering greater flexibility. So such as providing reasonable adjustments, reducing phone contacts, and facilitating online appointments, appointment booking to manage cognitive demands. So a quote from a participant in that study says, "I really like email because you've got time to process it and think about what to say. Phone calls and face-to-face, you're having to react quickly, and that escalates anxiety and communication issues." So our CMO statement for getting to an appointment is that if practices create environments that are sensitive to autistic sensory needs, for example, quieter waiting spaces, controllable lighting, patients experience less sensory overload and general practice becomes more accessible. So I'm just going to read that top quote there that came from a paper which we feel supports that statement. So, autistic people have described why waiting experiences are aversive. For instance, sensory sensitivities to light, to noise, to smell, or being too busy. Several participants had either been given or would like to be offered alternative waiting arrangements. And then the final part of the patient pathway that I'm going to talk about is general practice interaction. And the CMO statement for this is that if GPs communicate in a way which aligns with the needs and preferences of their patient, information processing demands are reduced, the patient feels less anxious, and comprehension is improved. And I'm going to skip to this quote. It's a bit of a long one. And this came from the Mansour 2024 paper, and it says that during direct contact with patients, healthcare staff should adjust their communication and language to align with the communication differences and preferences of the autistic person. This can include using unambiguous words with no metaphors, visual or written cues to explain abstract concepts, and closed-ended questions if someone is struggling to answer. Similarly, all participants highlighted the importance of having additional processing time to help reduce anxiety and improve comprehension. Moreover, familiarity and knowing what to expect before, during, and after the consultation were deemed essential to high-quality care. So, in our final paper, which should be out next year, what we have are lots of those types of CMO statements, and then we have hundreds of extracts that are used to inform those CMO statements. So you'll be able to look at those in more detail when that paper is published. So next steps in terms of the project, we are producing guidance for general practice on the potentially helpful changes they can make to their services, and we want to produce guidance for autistic people to help them to navigate general practice. We also want to share and highlight existing guidance and resources. We don't want to reinvent the wheel. And those resources that we do highlight will be selected with our stakeholders and autistic collaborators. So if you're aware of guidance and tools, please let us know. We've heard about some fantastic work here at the conference, and we will be including that in the group of resources that we highlight. But the challenge that we have, and the GPs and practice staff that we're talking to, is that influencing change in general practice is hard. So some of the issues that GPs are talking to us about are around, we know that there's a knowledge gap, but how and in what format do we share relevant information with practice staff? Because GPs are telling us that they don't want more training, and they definitely don't want mandatory training. So that's a challenge for us. There are also a lot of pressures around general practice that we're aware of. It's a time-sensitive environment. Some GPs are feeling very overwhelmed. There's a lot of burnout in general practice at the moment, and there's overwhelm in the face of what they don't know and what they need to do with regards to autism. And then there's also issues around identification of autistic patients. So GPs don't always know which patients are autistic, and that's for a whole variety of reasons, including autistic people not disclosing because it doesn't feel safe to, or because people are worried about the consequences of disclosure. And if people do disclose, then there are inconsistencies in how autism is coded in GP systems, which can affect GPs and how they interact with their autistic patients. So those are some of the challenges that we're kind of bearing in mind as we think about what resources we develop and how we promote those. In terms of some conclusions, what we've identified is that in the pool of research that we've been looking at, there's a lack of intervention studies. We need more research which is testing out different ways of working. There's disaggregated data for autism and learning disabilities isn't happening, so it's going to be quite hard for us to make conclusions around autism and learning disability when researchers aren't disaggregating. And there's a lack of consideration of intersectionality as well. So that's one of the challenges that we will find when writing this up. And I wanted to also end with some reflections from our autistic assistant reviewers who are concerned about the lack of diverse participants in research, poor reporting of demographic characteristics in research, poor reporting of demographic characteristics in general practice, which influences reporting in research. As I've just mentioned, treating autistic people with or without learning disabilities as one homogenous group with no consideration of different care needs, and also people's experiences being invalidated. So I wanted to finish with those reflections there, and I think that gives us lots of food for thought for thinking about particularly the researchers in the room. So we would love to speak to anyone that is interested in this work. Those are mine and Kelly's contact details, and we will be around after the session if anyone would like to speak to us.
Thank you, Claire. And I think we have time for a couple of questions if anyone would like to come up to the mic.
Everyone wants tea and biscuits.
Anyone? That's absolutely fine. Oh, please join me in just thanking Claire again and thanking all our speakers. A fantastic session, and I feel like I've learned so much. So thank you all. Absolutely brilliant. And thank you all for joining us.